Hello, everyone, and welcome to this Arthritis Action webinar, Beyond Medication, Effective Therapies for Managing Arthritis. I'm Mark Williams, I'm the Services Manager for Arthritis Action, and today Dr. Wendy Holden and I will be discussing some of the complementary, alternative and lesser-known treatments and therapies available for arthritis. Before we get underway, though, I do have a few housekeeping items, as always. So you'll be muted throughout the webinar. So if you do have any questions about any of the topics we discuss or anything you'd like to know a little bit more on, please do type these in the Q&A box. It's going to be, quite conversational today, so there'll be lots of things and lots of opportunities for you to put those questions in if you like to. But we will do a section at the end where we go through anything that may not be relevant. So don't worry, we're not ignoring you. It might just be one better served towards the end, or we might be covering what you've asked in a few minutes or something. But we'll endeavour to ask as many as we can during the time allotted. But in the event we do run out, like you've got loads of great questions or something, we'll get back to you with an answer by email within a few days. So, please bear with us on those. And finally, to remind you that this webinar is not a substitute for medical advice. So please always consult your doctor or medical professional for any questions regarding your own medical conditions. So, without further ado, and for those of you who don't know already, I'd like to introduce our speaker. So I'm joined once again by Dr. Wendy Holden. So Wendy is an honorary consultant rheumatologist at North Hampshire Hospital's NHS Foundation Trust and also Arthritis Action's own medical advisor. So, hello, Wendy.
Hi, good. It's so exciting to see so many people here. So I think that's kind of tribute to the topic. Thank you for choosing it, Mark. It's a good one.
Absolutely. Yeah, I'm really interested in this one. This is going to be a lot of fun. So I think if we start off, because we're going to be talking about a lot of the different and maybe some of the alternative therapies and things that are available to treat arthritis. What do you think are some of the more mainstream ones, just so we kind of get those out of the way?
So I think when I first started training, things like acupuncture and was considered fairly fringy, and osteopathic treatment. I have to declare I am or was an osteopath, so it was fairly fringy when I qualified. But it's become very much more mainstream now, and often NICE recommend some of these things for certain conditions. So it's not really considered so as complementary or alternative as it used to be. So in that group, I would put acupuncture, osteopathy, chiropractic, and massage as well, which is also recommended by NICE for various issues that we can come to.
Okay, great. So we've got a few different sections for this one. So I'm going to basically, as we've done some of the other ones we've previously done, Wendy, I'm going to basically be throwing a few things out at you and then seeing what your thoughts are on them and, what works, why it's good, or why maybe it's not necessarily recommended.
Yep.
So I'm going to start off with a few things sort of more around herbal medicines. So that's an interesting one.
Yeah, that is a really interesting one. And I think a lot of people feel that because something is a herb, that it's safe, intrinsically kind of safe and natural. It certainly is natural, but I think it's not to be forgotten that a lot of poisons are herbs as well. So like aconite and obviously morphine comes from poppies as well. So herbal remedies are not to be taken lightly because they have pharmaceutical properties as well. So it's really important to just be careful. And if you're going to start a herbal remedy, to just make sure you check that any medication you're taking already won't interact with that. A famous one is St. John's wort, which probably everybody knows about now, but it used to be a common remedy for mild depression, but it interacts with lots and lots of other drugs. So not so popular now, I don't think.
Oh, okay. I think a lot of these are probably going to be ones that have maybe fallen out of popularity over the years.
Yeah.
Why do you think that is, actually, before we get started? Why do you think some of them are considered really go-to ones to start with, but then as time goes on?
Yeah, I wonder if it's just that new things become available. So, for example, ginger and garlic have been popular for a long time, things like ginkgo. And things kind of come and go, don't they, with popularity. And I suppose a lot of people try them and find that they don't work necessarily for them, so they move on to something else.
Okay, so one of the most common ones we hear a lot about is devil's claw.
Yeah, devil's claw is an interesting one. If you look at a picture of devil's claw, the root of it looks like a claw, so it's called called devil's claw. And that one has definitely has some anti-inflammatory properties, but it's one that you have to be careful of if you're already taking drugs like anti-inflammatories, which can affect blood clotting and things like that, because any drug that's got anti-inflammatory like properties has got the potential to interact with other anti-inflammatories and potentially cause harm in the gut. But it does have some anti-inflammatory properties. Hasten to add that none of these things we're going to discuss in terms of herbal remedies are NICE approved or in any way kind of an alternative to conventional medicine. It's just something that people might want to try.
Cool. Actually, do you want to explain NICE approval? Because I know we're going to mention constantly throughout.
Exactly. So NICE stands for the name escapes me just now, but it is the body that approves medication and treatments in England.
It's
And
the
it's
National Institute for Health and
Thank
Care.
you so much. Health and care excellence. Exactly. Thank you so much. So they approve things like expensive medications, and they approve things like treatments for back pain and so forth, and osteoarthritis. And so it's an extremely rigorous process. Lots of people think that these are, not independent of the government, but they actually are. They're completely independent of the government, and it's a panel for each topic. They recruit a panel of experts, and that could be doctors or nurses or service users or charities, to look through all the evidence that their information finders will put in front of them. So these information gatherers are very experienced researchers. Say they're looking at the topic of, say, acupuncture for back pain. They will look at every single publication that's ever been done on acupuncture and back pain, and then they will present a summary of this to all the experts, who will then come up with a recommendation. And sometimes they fall in favor of some of these treatments. So, for example, acupuncture used to be in for back pain, and it's currently out for back pain. And that's because the committee will sit at regular intervals to review the new evidence that's up and coming. So you can be sure that what they are saying is totally evidence-based. Sometimes they do pontificate a bit about cost, because obviously if a treatment is costing, £1 million a year for one person, that's not going to be doable for the NHS. But they don't usually get involved in those kind of decisions. They just advise on whether it's sensible or not. And then once something has been NICE approved, so for example, a biologic treatment for inflammatory arthritis, then if people qualify for that treatment, then they are legally entitled to receive that treatment on the NHS. So it's a very, very rigorous kind of process. But when these new guidelines come out, experts are always sort of disagreeing and muttering to themselves and saying, well, no, I don't agree with that. But however, the experts have reviewed the evidence. So it does mean something.
I guess there'll always be some degree of interpretation and professional opinion in what's correct.
Yes, exactly. So, for example, TENS machines. So lots of people know what a TENS machine is. It's what lots of pregnant women use when they're giving birth. Until recently, TENS machines were approved for all sorts of things like back pain and osteoarthritis and generalized pain, but it's now been removed from all of the guidance on primary pain, primary chronic pain and back pain and osteoarthritis. I'm not totally clear why, but I presume that they've been through this process to do with TENS and found that it's not more effective than not having TENS. But surprisingly, the NHS website has still got a very up-to-date article about 1010 saying that it will help you. So and obviously physiotherapists are still recommending TENS to things. So there's sometimes a bit of a conflict there, which kind of raises the issue of, if something works for you, why not? If you find a TENS machine helpful, fantastic, go for it.
Excellent. Well, it's always shocking. That's been one of the mainstays of like all the literature surrounding the various conditions like that, hasn't it? Like TENS machine have always been omnipresent, it feels like.
Exactly.
Interesting. Okay, so back to our herbal ones then. A slight digression, but yeah. So
sorry.
That's all right. No, it's all good. I asked the question. I do this to myself. So rose hip. What do you think about rose hip?
Rose hip. Everyone, even a generation beyond me used to be given rose hip syrup because it's just chock-a-block full of vitamin C. Rose hip has also got some anti-inflammatory properties for osteoarthritis, so that is sometimes worth trying. And again, you've got to be careful of any interactions you might be having. It's full of vitamin C, which is an antioxidant as well, so that might be worth a try.
Excellent. What about collagen?
Okay, so collagen is the substance that plumps up our skin. It's what keeps us kind of plumptious when we're young, and as we age, we tend to lose a lot of collagen below the skin. And collagen also makes up a large part of the structures around joints, for example, and it's in part of cartilage. So it would seem to be a good idea to eat lots of collagen, wouldn't it? And that generally comes from marine fish, cartilage from marine fish. However, whatever we eat in our body gets digested. So collagen that you eat or collagen that you put on your face cannot be turned into collagen in the body. There is no evidence for that. However, eating a healthy diet, as we've discussed zillions of times, is the way to go with that. So collagen, no evidence for that.
That was one thing as well you and I discussed when we were going to mention, even though we're talking about all these sort of alternative therapies as well, did want to mention the actual good recommendation, which when it comes to things like herbal medicine or dietary intake, just a sensible, good quality, nutritious diet is probably the most important thing you can do in those senses.
Yes, 100%. And we were going to talk about nutritional substance diets and things, weren't we? But I think anyone that's thinking about changing their diet dramatically just needs to be very careful about extreme exclusion diets, and also the therapists who are suggesting these extreme diets. Make sure you check their qualifications and why is it they're saying to you that you should only be eating, eating no gluten, or eating no dairy, or eating no sugar, or things like that. Obviously, reducing sugar is a sensible idea, but just be really careful of restrictive diets.
Absolutely. So this is one that always comes up a lot, and I know it's still kind of, you do get it sort of prescribed sometimes as well. It's glucosamine.
Yeah, glucosamine and chondroitin. In fact, NICE did recommend those at one time, or rather, they didn't recommend them. They said try them for 3 months, and if it doesn't work, then stop it for osteoarthritis. But again, that's another one that's gone out of fashion. Again, there isn't much evidence that they help in these large randomized controlled trials. However, individuals may find benefit, and they won't cause any harm. So that's another thing that's important with any alternative that you try, that it's not going to do any harm. That's obviously as important as it helping.
Absolutely. And another hot topic one that I feel is quite often always covered, but I'll throw it in there anyway.
Yeah.
Because people always do ask. I think we had an email about this in advance as well.
Aha.
Which is, what are your thoughts on turmeric?
Interesting. Everybody always asks about this one, and Martin's a big he's always asking questions or answering questions on turmeric, isn't he? So turmeric has got an active substance in it called curcumin. Curcumin for sure is anti-inflammatory in lab experiments and animal experiments. Definitely anti-inflammatory. However, the amount of curcumin that you've got in turmeric is very, very small. It's only about 5%, 3 to 5%, something like that. So there have been trials done on curcumin and anti-inflammatory properties, and they've used up to 1,500 milligrams a day in the trials, and that, which is 1.5 grams. So 1.5 grams is not very much. It's just a tiny bit of sugar on the end of a teaspoon. So that's the curcumin. But you would have to eat about a whole weight of an egg to get the equivalent in turmeric, if you just ate turmeric. Wow. So imagine, nobody could possibly eat that weight of turmeric in a day. So these little capsules that you're getting of turmeric will not have enough of the active ingredient in it to do anything. However, again, placebo effect is one thing that we're going to talk about too, isn't it?
It's a real thing, and it's not necessarily a bad thing sometimes.
I 100% agree with you, and I think if you take something and you find that it's helpful, continue. Who cares if it's not proven to be of benefit? If it helps you, go for it, go with the flow.
Excellent. Let's move on from herbal remedies then and move into some more like treatments and therapies. So we've already kind of mentioned, physiotherapy is one you mentioned. I know if you go to the NHS, that's usually the first port of call for everyone, really. Also massage as well. And also osteopathy as well.
Yes. And chiropractic, I would put in that as well. So what all the guidelines say regarding things like back pain and primary chronic pain is that they recommend a knee osteoarthritis as well, knee and hip osteoarthritis, comes down strongly in favor of using a trial of manipulation therapy. Hands-on therapy specifically is what the NICE guidance says, and that can be massage or strengthening or stretching. So that kind of treatment is provided by osteopaths, chiropractors, and massage therapists. It has to be done in conjunction with other exercise therapy as well to obviously build strength, and you'll know all about that, Mark.
Of course, that was going to be our recommendation as well, wasn't it? As well, with all these
Absolutely.
therapies, it always has to also include some exercise as well. None of these, none will 100% take the place of exercise.
Absolutely right. So we're meant to move, and we should be moving. But interestingly, I don't know if anyone. I don't mean to be in any way dismissive of physiotherapy, but if you have NHS physiotherapy these days, it's quite hard to actually get someone to put their hands on you, and so I'm not quite clear why. If there's any physios watching, perhaps you could let us know. But often private physios will certainly put their hands on you, and they often are more into massage and acupuncture and things like that. So I think the importance is that manual therapy is definitely recommended for lots of conditions, including osteoarthritis.
Excellent. So, speaking of manual therapies, and now I'm going to go on a really weird opposite end of the spectrum, I suppose, here. So, a popular one that does come up a lot is Reiki.
Yeah, interesting one, Reiki. So no expense spared. I have been researching all these therapies over the past few weeks. Reiki's a very interesting one, and I have friends that really love their Reiki sessions. So what Reiki therapists believe, what a Reiki therapist will do is you'll lie down or sit down in a quiet room, and they will either touch you gently or they will put their hands over you gently, and they believe that they are in some way channeling the body's natural energy flows as I understand it. Now, the difficulty with understanding this is that we don't really know what they're talking about, which sounds harsh. However, lots of people do report feeling better after they've had a Reiki session, and I think it might be something. Maybe they are channeling energy. Who knows? I don't think there's any evidence that that's what they're doing. The explanation is hard to grasp, isn't it? But I certainly think that lying down in a nice quiet room with a kind therapist who's going to be very gentle with you, and it might be dim lighting and a nice smell in the room, it's going to be calming, isn't it? And if you're feeling calmer, chances are your pain's going to improve and you're going to feel a bit less anxious and you might sleep better. So again, it's not doing any harm. It's I think just for the medical profession and healthcare professionals, it's just difficult to understand what's happening and what's going on in that situation.
I'm certainly one of those. As a former massage therapist, it's the exact opposite to what I've been taught.
Yes.
I cannot wrap my head around how that can be beneficial.
Yeah.
Again, same as you, I'm not saying it absolutely doesn't work because there's so much we don't understand in general. But like I say, a good manual physical therapy, like actually getting in there and working a muscle, in my brain that makes more sense. But of course,
to me too, because you're actually kind of doing something, aren't you, rather than just sort of experiencing something that doesn't make sense. Yeah,
you can
I
feel
agree.
it. You can feel a knot in the muscle. You can feel when a muscle starts to ease and when more relaxation happens. It's a very physical, tangible feeling. So, yeah, I highly recommend it. But yeah, again, so does NICE. So it's all good. Okay, the next one. So is another interesting one. Perhaps I don't know if the term New Age is correct for these things anymore.
No, I don't know. Some of these are quite mainstream, aren't they?
Yeah, forgive us if that's not the correct term these days.
Yeah.
But grounding or earthing.
Yeah, this is a wild one. So this is something that was trialed really, or the massage therapists came up with this idea. So it's like maybe that's how you know a bit about it. But the theory goes that there are the surface of the Earth is negatively charged. Guess that's true. In other words, it has electrons on it, and by making contact with the Earth, either with bare feet or lying on the ground or through something called a grounding mat, you are somehow able to use these electrons to heal yourself and act as an antioxidant. Now, again, that I don't think there's any evidence that actually that is a thing, putting electrons on your skin. Is that a good idea? I don't really know, but however, it might well make you feel better. Walking barefoot on a lovely lawn feels nice for sure. Lying on the floor looking at the sky also feels nice. Yeah, interesting. The explanation again is challenging though.
Mm. What are your thoughts on homeopathy? This is
Uh,
it's a much more commonly known one, I think.
it is, and I think most doctors have got strong views on homeopathy, which is that it's not complete nonsense. However, because the theory behind it just sounds like nonsense. So the idea is that by having minute dilutions of a substance, you somehow can trigger healing and so forth in the body. But the dilutions are so dilute that you can't actually find the molecule that you were looking for in the first place. So lots of people think that you are just having water or solvent when you're doing homeopathy. However, again, it's not going to hurt anyone, apart from it being expensive potentially. It's not going to hurt anyone. Definitely not an alternative to conventional meds for lots of conditions, though.
Ooh, excellent. Okay, what about aromatherapy?
Yeah, aromatherapy is an interesting one because what aromatherapists do is that they use essential oils of plants. So plants contain substances, garden plants with a smell contain substances called terpenes. So, for example, lavender, lemon balm, rosemary, hops, they've all got a very distinctive smell. And those are the terpenes in the plants. And certain of these plants have been shown to have a definite effect on the body. So, for example, um, lavender has got a relaxing effect on the body, has got some evidence that it might be calming, reduce anxiety. Rosemary may have some evidence, some slight evidence that it might improve thinking or cognitive function. They've done a few studies on that. What I think is really interesting that there are some people who my mum was used to swear that certain perfumes gave her a migraine, and I thought she was mad, but it's absolutely true. So certain smells in certain people can trigger a headache and trigger migraine. So there is definitely some kind of link between a smell and the brain function and pain. Who knows? However, I think that, again, the explanation of um, aromatherapists would be that they are providing a therapeutic benefit by using rosemary or lavender or whatever on the skin. And there's no evidence for that. Safe again, unless you're sensitive to the oil and you might have a bit of burning or a rash or something like that, but it's safe. Very relaxing aromatherapy. It's often used in palliative care and in cancer situations. Very relaxing.
I was going to say that sounds like just some of these we mentioned. If they do have that relaxation aspect, as you kind of already mentioned, it might be
Mm.
useful because if you struggle to relax or like switch off, or it can if it helps you get into a more relaxed state, that potentially could have an impact on your pain levels, couldn't it?
Absolutely. Yeah, absolutely.
Okay. What about reflexology?
So another interesting one. So reflexologists believe that there are areas on the sole of the foot, also on the hand and on the ear, that correspond to areas in the body. So they believe that for example, they will feel the sole of your feet, and that would correspond, say, to the area of the liver or the heart. And then they would say, I think you've got a problem with your liver or your heart. Let's massage that, and we will treat that, and that will fix that condition. So they would do some massage on your feet or on your hands or on your ears to change that condition. I don't think that there's great evidence that there are areas on the foot that correspond to the areas in the body. However, again, having your feet massaged by somebody with lovely oils, and I don't like it personally, but other people find it really, really not really nice. And again, that's something that's used in cancer treatment, for example. So it's been shown to reduce anxiety in people having chemotherapy and things like that. So again, if it works, give it a go. But I just don't. I think the explanation is a bit incredible at the moment.
It does seem to be one that I think like it's such a commonly known one though. I feel like that one's been
Mm,
around forever. So it is
yeah,
interesting to know. I mean, for some of these things, is there still more research being done in an official capacity for them? Do you know?
I think so. They try, but I think a lot of these therapists are quite out there and isolated. The organisations that they come under would be trying to do research, but again, it's very difficult to do placebo research on reflexology, for example, unless I suppose you're deliberately targeting the wrong areas of the foot. I think most healthcare professionals would have an issue with thinking that you can treat a condition of the liver by having your foot massaged. It doesn't make any sense.
Okay. Excellent. Oh, we have had one in the chat, which I realise we probably should have put this into the herbal one. Actually, I completely forgot to do so.
Aha.
But yeah, thank you very much for reminding me. Whoever put that one in. So CBD oil is a very
Yes,
common one that's mentioned a lot now. Could you talk to us
it
a bit about
certainly is. Yeah, everyone's taking CBD these days. So lots of people think that if they have CBD, they will get high. So that's not in fact at all true. So the cannabis plant contains lots of things, again, called terpenes. It's a smelly plant that contains lots of different terpenes. One of these is CBD. And CBD also comes from the hemp plant, which is related to the cannabis plant, but different. It doesn't contain the other substance, which causes the euphoria, which is called THC. So CBD is you can legally buy CBD over the counter, and it is not intoxicating. Now, the tricky thing is that CBD in this country is classed as a food, and as such, there is very, very little regulation of what there is on the shelf. So it's perfectly possible for a bottle to say that it is CBD and there are 1,000 milligrams or whatever in there, and in fact, it's basically cooking oil with nothing in there. So studies have shown that at least 60% of the bottles that claim to have things like CBD in them don't have CBD, or they don't have what it says on the label. So the regulation is very challenging. However, if you go to animal studies and lab studies, CBD taken in enough of a quantity in large amounts, which is probably not what you can buy over the counter, is very effective as an anti-inflammatory, and there is emerging evidence that it might help with anxiety and sleep as well. However, there are no decent clinical trials of this CBD being used on its own, and the IASP, which is the International Association for the Study of Pain, the big umbrella pain organization in the world, really have not come down in favor of any form of cannabis medicines for chronic pain, unfortunately, at the moment, because although lots of people use those medicines for chronic pain, there aren't the big controlled trials that are needed to get mainstream approval, really. So again, if it works, absolutely go with it. It's not likely to cause you any harm, although it's metabolized by the liver, so be careful with drugs that are also metabolized by the liver. So in the context of arthritis, disease-modifying drugs.
Okay, great stuff. So let's now move on to fringe therapies. I suppose we'll call them
We
for.
haven't been fringy enough.
No, exactly. Let's get fringy. So the first one on my list is like some of these again are not necessarily really commonly used,
Yeah.
but they are out there, and I know that people do like to ask about these things. So as we have a
Okay.
professional here, I'd love to get your opinion on them.
Yeah.
Craniosacral therapy.
Yes. Okay. So this is a subset of osteopathy. Now craniosacral therapists are generally osteopaths by training who've branched into this as a sideline. So craniosacral therapists believe that there is a flow of the spinal fluid that is around our brain and around our spinal cord, and that is the abnormalities in the flow of this spinal fluid can manifest as disease. Furthermore, they believe that if they hold the head or hold the sacrum, which is one hand either side of your lower back and one hand on your belly, they can feel the fluctuations in the movements of this fluid, the cranial fluid that we've got, and that they can treat disease by manipulating this flow of fluid. So I got a couple of issues with this. First of all, the brain, the skull, is the sutures of the skull. You know, anyone that's got a small child will know that they've got two little holes in their brain, and that's before the sutures will form. The sutures knit together to form an unbelievably tight structure in the skull. That's why if you get bashed on a head with a rod, it won't break the sutures, it will break your skull. So to me, it seems not impossible, but not feasible that you'll be able to feel through this very tight skull that the pulsations underneath are very weak, and even more unlikely that you're going to be able to adjust the flow of fluid by moving the cranium or moving the sacrum, which is the bone at the bottom. So it just completely seems complete nonsense to me, this explanation. However, again, you're lying in a nice quiet room, someone is holding your head. Lots of people like to have their head held. Babies love having their heads held, and it's very, very calming to have a nice person who's a clinical person, nice and friendly and kind, looking after you, wrapped up nicely in a blanket. So there may well be some benefits, but again, it's the explanation that seems crazy.
That seems to be a running theme for a lot of these as well, doesn't it? So we're not necessarily poo-pooing them, so to speak. It's just
Yeah,
the evidence isn't there, but if they work for you and
no,
they're not harmful, then it's
correct. I agree, and I'm sure that I would, if I tried everything else and I hadn't tried that, I'd give that a go as well, just to see if that helped me. Absolutely, but I just don't like the explanation.
So we touched on this one earlier on, but I have it on my list of the fringe therapies one, and I know a
Yeah,
couple of people have mentioned something in the questions as well. So we'll revisit this one, which is nutritional therapy.
yeah. Is there a specific question in there about nutritional therapy? I can't see
I
that.
think because there are some types of ones that are even available in like places like Harley Street.
Yes. So, basically, if you want a therapy, you can probably find a private person or a private doctor who's going to give it to you. So, for example, there are plenty of places where you can get intravenous vitamins, for example. Um, I don't know why anyone would want intravenous vitamins, and if if you're eating a healthy diet, you won't be deficient in vitamins. So, I don't think there's any evidence that that kind of treatment helps. There are also people who will give you intravenous saline drips to help with chronic fatigue, for example, because they say that expanding the blood volume might help with chronic fatigue. Again, that is not physiologically sound, because if your blood volume is expanded with a bag of fluid, what your kidneys will do is deal with that within an hour and it will all be gone again. So there's that is, again, it's unfeasible.
The
Um,
idea of expanding blood volume
mm.
blows my mind, essentially,
Yeah,
because there's a finite amount of space within your
of
system,
course.
surely.
Yeah, absolutely. And I mean, let's suppose you had 5 liters of saline fluid pumped into you, you'd be extremely unwell because your body would be very, very diluted. So I don't think they probably wouldn't put that amount of fluid in you, but it doesn't make any sense at all. Our body fluids are very tightly controlled by our physiology.
Mm. So we did have on the sort of the term of like someone did have a question about elimination diets, which I feel can
Mm.
kind of slot in here, I think, actually. So
Yeah, yeah.
said,
Now yeah.
it
So,
said I'll read out the question, seeing as
oh,
like
sorry, Mark. Yeah.
so you warned against elimination diets or eliminating certain foods, and I wondered if you could comment on doing this as a way of finding out what food sensitivities you may have. The idea
Yeah.
that the elimination part is temporary and the end game is to reintroduce foods and see how that
Yeah,
impacts your.
absolutely. I absolutely would agree with that, because sometimes, we eat so many different things. It's impossible to know if we've got, tummy problems or feeling sick or bloated and so forth. We haven't got a clue which thing it would be. So I would totally agree with that. That elimination diets, provided they are done safely and you are having enough calories to keep you alive and enough fluid and enough vitamins and things like that, are safe for short periods, and then gradually introducing foods that are not immunologically sort of stimulating, for example. I totally agree with that, with supervision, and make sure that the person you're doing it with is completely qualified. And if you're not sure, don't be shy and ask them what their credentials are, because
Mm,
anybody can call themselves a nutritional therapist without being I believe you can be a registered dietitian, and that is a protected title, but anybody can call themselves a nutritionist, and in fact they may be nothing of the sort. Go have a GCSE in biology or something.
absolutely, and also I think a lot of
Mm.
looking where the evidence they've used has come from, sort of as you're saying with people's qualifications. I think a lot of evidence is anecdotal, which is not solid evidence. Like they may have found
Yeah,
very good benefits. Like I think a good example of that one that I always hear a lot, and I've spoken to a lot of people about this is again is a very good example of a extreme elimination diet, or something like the carnivore diet,
Yeah,
where that claims
yeah.
to reduce so much inflammation and all this by cutting out all vegetables and fruit and so on, which is your body needs those things. They're filled with so much nutrition that your body actually requires. And, instead replacing it with things like butter and so on, not good for your body in general.
Absolutely not. Yeah, absolutely not.
Okay, so this is a very interesting one. I've been really looking forward to your thoughts on this one. Is about stem cell treatments.
Yeah, stem cell treatments are a interesting thing. So there is a treatment called autologous chondrocyte implantation, or ACI. Now, what that means is this is a treatment that has been approved for NICE for osteoarthritis of the knee. And what is done in this process is that uh, a small patch of cartilage cells from your own knee is taken away, grown in the lab, and then that can be re-implanted into a cartilage defect in your knee, and that can help significantly with certain types of osteoarthritis in the knee. So that is a type of stem cell transplant, if you like. There are other types of stem cells which are called, for example, mesenchymal stem cells. And these are cells that can be taken, for example, from fat or from the blood, and can be spun down into a concentrate and then injected into various parts that hurt. Now, this is not at all recommended on the NHS. So there are plenty of doctors who will be before performing these inverted commas stem cell procedures using your own fat and injecting these cells into painful joints, painful tendons, with all sorts of claims of benefit when there is no evidence at all that these can help with pain. So with the chondrocyte transplantation, definitely can improve pain and stiffness, which is why it's approved and can be got on the NHS. Any other type of stem cell treatment, you have to be very, very careful of. This is going to be something that probably only private providers will offer you. And again, you've got to ask, where is your evidence? How many people have you done this on? Because anything involving an injectable treatment has got the potential to cause local harm, infection, and so forth. So be very, very careful. And some of these treatments can cost a fortune.
There are also, I have heard some, it's an absolutely crazy one that I heard once, and
Yeah.
I'm assuming I know your thoughts on this one, but I believe that there was one place, so according to the internet, forgive me if this is not 100% factual, but the treatment itself is quite mad. It was where people were being injected with shark stem cells.
Wow. Interesting.
Because they're such like adaptable creatures that are resistant to so many different.
Yeah, so I should say that what stem cell is a cell that can turn into lots of different kinds of cells. So we all have when we're tiny little embryos, we have lots of stem cells in us because they will evolve into bone, cartilage, hair, so forth. So a stem cell is a cell that can turn into all sorts of other different cells. Now, the problem with this is that we don't know if we take, suppose we take a shark stem cell and we inject it somewhere. Is that going to turn into a shark fin or a shark tooth, or is that going to turn into a human something or other? We really don't know. It's very, very complicated. I'm sure it wouldn't. There is uncertainty about what these cells can become because they have the potential to become other cells.
Okay, there was one as well I wanted you to talk about as well, about umbilical stem cells.
Yeah, yep. So this is a really interesting one. So when a baby is born, the umbilical cord contains stem cells, so stem cells for that baby. So it is possible to extract these stem cells, keep them in a freezer, and they will be a unique source of cells potentially, which will genetically match that baby who has just been born. And this is very much a blue sky future way of looking at things. These potentially are the cells that could be grow. I think we're a million miles away from doing this at the moment, but there is a theory that you could stimulate these cells, say, to produce a new organ or a new a new limb or something like that. We're a million miles away from that. However, some people are using their child's stem cells in themselves, and there are clinics where you can go and have these somebody else's stem cells injected into you. Again, very fringe and well, I don't know what to say about that. I don't. I'm sort of lost for words for once. Really, I certainly wouldn't do it myself, and I think it's potentially a risky thing to be doing.
Yeah,
Certainly not a treatment for arthritis.
no, yeah, we should add that.
No substitute for exercise and
Exercise,
healthy eating.
exercise and diet. Please be sensible with both of those, and you'll get wonderful things. And you
Yeah,
maybe don't have to try shark stem cells or anything crazy like
yeah.
that. Okay, so last one here I have on my list is a platelet-rich plasma.
Yep. So what that is, again, to some extent, that is available for certain conditions on the NHS, but it's very much in the we're not quite sure if this works kind of situation. So what that is platelets are little cells that we have in our blood, and they are important for blood clotting. So to get some platelet-rich plasma, what the healthcare professional will do would take some of your blood, spin it down in the lab, and then concentrate the platelets, these cells, in the blood plasma, which is the liquid part of the blood that we've got. And then these platelets contain chemicals that are thought to stimulate healing, and then the doctor will inject these into various parts. So, for example, they can inject them into joints, and they can inject them into areas where there are inflamed tendons, for example, elbow tendons for tennis elbow. They've been trialed in the plantar fascia, which is the sole of the foot, which can be very painful and inflamed. Now, they are only supposed to be used with in the context really of trials. So for people that are having these, but the doctors are supposed to keep lots of records to see what's going on, because there isn't really enough evidence that these might be beneficial, but some people find that they might be helpful. But again, you're injecting local anesthetic within there at the same time, so it could be an effect of the local anesthetic rather than the platelet cells per se. It's an interesting one. Not totally fringe, that one. It's becoming more mainstream. I guess if we do this again in 2 years' time, that one might be one that's picked up by the NHS a bit more.
I suppose, yeah, as we were saying at the beginning, like some things fall out of favor or come into favor. And maybe that's one of the things that in the future, maybe some of the stuff off this list, if we were to do this in 20 years' time,
Yeah.
we were saying, like, why wouldn't you be doing stem cells or platelets or any of this stuff if it's
Yeah.
all figured out and proven by that point?
Yeah.
Excellent. Okay, let's move on to some questions now, because we do have a bunch of them that some of you have been adding. I had a couple in from emails as well, so let me just have a quick look. Okay. A little bit long. I'll just make it a little bit more concise. So it'd be grateful if you could shed any light on the connections between hormone imbalance and autoimmune disease, and what treatments might be helpful for that.
I'm guessing that means estrogen imbalance.
I think there's a potential of them being premenopausal or post.
Yeah, exactly. So for sure, estrogen is involved in pain threshold, that's for sure. So premenstrually, as we've discussed in another area, women often have an increase in their pain when the estrogen drops. Similarly, perimenopause and postmenopause is associated with an increase in joint pain. In addition, autoimmune conditions are more common after the menopause. So rheumatoid arthritis, for example, is more common after the menopause. So there is a hormone aspect there, but we don't understand it. I would say just if you are eligible for HRT, give it a go, because it can make a big difference.
Okay, great. So we actually have loads of questions here, everyone. So apologies, we may not get through to all of these, but I will do my best to filter through. And like I said, we will get back to you with an answer if we're unable to do this live. So, Wendy, what about autoimmune arthritis treatments? Seronegative, non-erosive.
Do you mean things like, I'm guessing that means things like herbal remedies for autoimmune conditions potentially? I mean, any of the therapies that we've discussed, feel free to give them a go. If that question is about, sorry, I've lost the track of my. If that question is about specifically about herbal remedies, then again, give them a try, but just be careful if you're taking conventional meds. I just saw a question there, Mark, about
Yeah, if there's anyone you
New
want
age.
to...
I saw something there about calling some of these therapies new age, and the question is in reference to calling some of these things new age. Lots of the new age therapies are indigenous to different cultures, of course, and have been used for many years. Yes, just because the NHS or Western medical system hasn't researched them, it doesn't mean there isn't research out there. I would totally agree with that at 100%. For example, traditional Chinese medicine is something that we can't possibly understand with our Western paradigms. However, NICE do extensively research throughout the world. So if there is research that's been published, they will find it.
Excellent. That's good to know. So a couple of people have asked about sort of Chinese medicine as well, but I think a lot of that does cover, as we were talking with some of the other therapies we mentioned here, kind of do classify, don't they?
Yeah.
Okay. This is interesting. Any comments, please, on lymph draining for RA, especially in the hands?
Interesting. So the lymphatics are a system that our circulation delivers all the nutrients to our hands and legs, and then the lymphatic system pumps it all back again. So if we have a blockage of our lymphatics, so for example, people that have had their lymph glands removed for breast cancer will get very swollen arms because of the lymph is not draining back because the lymph system has been removed. I don't think there's any evidence that lymphatic drainage will help with autoimmune conditions. However, it's likely to reduce some of the swelling potentially, because if you're having massage to your arms, for example, if your hands are swollen, then that will help some of the fluid go back to the heart. But movement will do exactly the same thing. Contracting the muscles will do the same.
Good, great. Wendy, what about wet cupping, which reduces inflammation?
Don't know if it does. Wet cupping is a system of putting sort of bit like small yogurt pots onto the back, often with sucking up the skin at the same time. Nobody quite knows about that just yet. Obviously, it can be very painful, and it can certainly leave burns on the back. That's for sure. I've certainly seen some people that have had that. Don't know if there's evidence that it reduces inflammation, conventional inflammation, shall we say?
I believe there's dry cupping available as well, which is...
Yeah, there is. I'm not sure. I'm not totally sure on the difference. Sometimes people use a flame, don't they? A heat to draw up the cup. I'm not sure what wet
I
cupping
think
is.
it might be something to do with the pulling up of like the extraction of blood within it as well, and then also
Oh,
with
okay.
not.
Okay.
I think like dry is where it just sucks the
Yeah.
essentially.
Okay.
Yeah, we need to know more about that one.
Yeah, sorry, no, I can't answer that one.
Feel free to have a look as well, Wendy, if there's one that
Oh, yeah,
particularly...
let's have a look. Is fecal transplant therapy a treatment? Yes, it absolutely is. Great. That is a great question. So what this is people who have very severe abnormalities of the gut microbiome, which protects us, can have something called a fecal transplant, and it's not as grisly as it sounds. You don't have to drink it. This is something that will be inserted up the other end. So it definitely is another it's an option if you've got antibiotic associated issues with your bowel, definitely.
Okay, great. We have a few questions about steroid injections as well. I suppose they're quite commonplace, though, aren't they?
Yeah, steroid injections are definitely not fringe. So we use those all the time for very inflamed joints. So for inflammatory arthritis, and sometimes used a bit less so, I think, now for osteoarthritis, because there is a concern that if you have too many injections, it might damage cartilage. But they're used often a lot and can help with local pain and inflammation.
Okay. What about drinking olive oil?
Interesting. So olive oil's obviously got lots of fantastic properties. I think it should be taken as part of a healthy diet rather than as a medicine. I don't think if you drink, if you drank a whole bottle of olive oil every day, I don't think that would make a difference to having a tablespoon, for example.
With a lot of things, I always find when it comes to things like that with nutrition is like just add some more of it into your diet in general. If it's something that is healthy and beneficial for you,
Yeah.
just have maybe cook with a little bit more olive oil, add some salad,
exactly.
rather than necking a bottle of it, because
I totally agree.
you're most likely
They're
to...
not really sustainable either, I would imagine. There's a question here. What about Qigong and Tai Chi? Does it have an anti-inflammatory effect on opening joints? Absolutely, opening joints. Both of those things are excellent for pain and for movement and for balance. So absolutely go for it. And the breathing is very calming as well.
Excellent. I haven't heard of this one, ergotherapy.
Not sure what that one is.
No, we'll have to come back
Just let
to.
us know if you know what it is. Type it in.
Okay. How about MSM, green lipid muscle supplement?
Green lip mussel might have some anti-inflammatory properties. MSM, not sure. Not sure. Similarly, LDN, not sure. Not sure what that stands for.
With the many alternative therapies, isn't there something about random trials being very expensive to set up properly when there's no potential profit to be made from making them? There's no incentive to do the trials. Is that right?
Yes, that is 100% right. And small companies obviously can't set up giant drug trials. However, the difficulty with any of these things is that if you're only testing something on 20 people, you could just be getting the results because of random chance. We have to be slightly scientific about this. And it may just come down to lots of people doing research on small groups of numbers of people. So if you do 20 trials each with 10 people, then you can do some form of analysis on those 200 people. So it's not impossible, just more difficult.
Okay, time for one more, and then we'll move on.
There's one there of APOS trainers. Yeah, that is something I was recently asked a question about. So APOS trainers are special trainers that have been NICE approved for knee osteoarthritis, and it's like a special shoe with sort of knobbly bits in the bottom, and they can alter knee position, so they can help with knee osteoarthritis pain. Now, I don't know if these are actually prescribed in practice on the NHS. Please, could somebody let me know if this is actually happening, because they are NICE approved, but they are expensive. So I don't know if in reality people are able to get access to these. They should be if they've been approved. Yeah.
One useful place to go, but I suppose if you want any more information on that, a podiatrist would be the best person to see, because
Yeah.
obviously anything to do with footwear or lower limbs, podiatrists are your best bet for those ones.
Yep.
Right, as I know it is lunchtime for everyone who's watching this live, we will wrap it up there. But like I said, we will get back to you with an answer for any questions we haven't been able to do today. But before you leave, just to let you know, if you'd like any more information relating to arthritis or the topics we've discussed today, please do visit our website, which is www.arthritisaction.org.uk. We've got loads of resources and loads of information about self-management to help you manage your condition. As said in the communications beforehand, this webinar is being recorded and a copy of it will be made available. We will send you a link to everyone who was registered today as soon as the recording's available. It should be done within a week, we hope. And yeah, you'll be able to then watch it as many times as you like, and make as many notes back as you would like to. And finally, I just want to say a big thank you to Wendy for giving us her time today and for answering all of your excellent questions.
Thank you. I hope that was helpful. I hope we didn't ramble too much. Please send any questions.
Yeah, do let us know. If there's anything else you'd like to know, please do let us know. So thank you so much for joining us, everyone. Thank you from myself and from Wendy as well. And I hope you have a lovely rest of your day. Thank you. Bye-bye, everyone.